So here's two examples of patients I've had in the last 2 weeks. One that got a type 1 brow bossing and one that got a type 3. And once I show you their CT scan, you're really gonna be able to see why. So here's a quick and dirty guide to reading CT scans. Now, when we're looking at this, white is bone, black is air, and gray is skin, muscles, and everything in between. So this CT scan is slicing this patient up like a loaf of bread, going from one ear to the next. So in this case, this is where the patient's ear would be. This is the eye, this is the cheek sinus, this is the teeth. And now what I like to look at is the sinus and how aerated this is. So you see here, her sinus is aerated, but all of this part that's actually giving her the brow bossing, this is all bone. And so what I can do is measure the thickness of this bone. It's about 10 millimeters. Previous studies have showed that we need to take about 5 millimeters to really see a significant difference. So I know with some certainty in this case that I'm gonna be able to do a type 1 because I can safely take these 5 millimeters of bone or more and not enter her sinus. Now this is another patient that we have done in the last 2 weeks. And now look at this patient's sinus. So as you can see, this patient has pretty significant brow bossing. Now look at this bone compared to the last patient's bone. This bone is only 2 millimeters thick. So there is no way that I am going to be able to safely burr this bone enough to dig down this entire bossing. This patient probably needs the bone taken down to about here. So just filing this bone is just gonna leave her with a huge hole in this sinus. And so in this case, a type 3 brow bossing is required. And so there are some patients that type 3, where you actually remove the bone, reshape, and put it back on, is the best and safest solution.